Hi, Melissa. My instructor told me to follow you today with a patient. Is it okay to you give me a report with that?
Sure. This is Glenn Light. We're going into room 619. He is a 67-year-old male, African American. He's alert and oriented times 3. He's cooperative. He's not in any visible distress at the moment. His skin is dry and intact except for a stage 2 ulcer that is on his right heel. He has S1 and S2 heart sounds appreciated without murmur or rub, regular rate and rhythm, and no carotid brewery. His GI tract is flat, asymmetrical, soft, no tenderness, and bowel sounds in all 4 quadrants. He's got 5 out of 5 muscle strength in all extremities. His vital signs were all in the normal limits. And he's got equal and round reactor pupils, no extraocular movements, his lungs are clear, his breathing is unlabored, he has a full code, he has no known allergies, and his doctor today is Dr. Phillips.
All right, thank you for that. I have few questions for you.
Sure.
Why specifically is this client receiving an insulin? What action does this medication have on the body?
Okay, this client is a type 2 diabetic, so he has some elevated blood glucose levels today, so we are giving him his fast-acting coverage, and this is Lispro, and it helps regulate blood glucose by stimulating peripheral glucose uptake and muscle fat, inhibiting hepatic glucose production.
Oh, thank you. That's very good. When should you question administering this medication?
When the patient's CBG or blood glucose level is on the too low side, where he has hypoglycemia, you would not want to give this. Also, if your patient has not ordered any food or has food present in their room.
All right. Does this medication have a therapeutic serum level?
There is no serum level.
Oh, okay. Which physiological parameters should we monitor when the medication is being administered?
I would be checking all of the patient's vital signs as well as their CBG and also looking at their CBC.
Oh, thank you. What interventions must be taught to the client to ensure the medication is administered safely in the hospital and home setting?
At home, I would make sure the patient has teaching on signs and symptoms of hypoglycemia, and making sure that the patient knows to always have some sort of snack in their pocket or in their purse at home. And in the hospital setting, I would also be monitoring for hypoglycemia and hyperglycemia.
Oh, very good. What are the side effects and potential adverse reactions?
The most common side effect is hypoglycemia, but you can also have some nausea and vomiting as well as swelling and redness to the injection sites.
That's very informative. How will you know that the medication is effective?
The next time we check a blood sugar, the patient's blood sugar would be lower and the patient would be feeling a little better.
Oh, that's good. Good to know. Yeah, I think that's all for today. That's all the questions that I have for now.
Okay, perfect. Let's go into Mr. Light's room. Knock, knock. Hi, Mr. Light.
Hello.
It's Melissa, your nurse. This is Ingrid. She's the student that's working with me today.
Hi.
Ingrid.
Alright, I'm here to give you your insulin, your Lispro. I see you've got your tray already, so that's good. We can give this to you.
Of course, I know. I have at least
Just get into my computer here. You're always packing.
Oh yes. So I am going to
Okay, so it looked like your blood sugar was 290.
fill this halfway so that we can see the
What we're gonna do is
drops.
get into your chart so we can check your sliding scale and see what the doctor wants us to give you.
Just
Okay.
fine. Okay. We just flushed it. Or primed it. So it's primed okay. We're going, we clean this, we clean this. So that they're now both sterile. Connect.
Okay, so 290 based on our sliding scale, we are going to give you 6 units of your insulin.
Put it.
Cool.
I I push channel select, it brings me back to my main screen, right?
How are you feeling today?
Good.
Right?
Alright.
So
Yeah,
now it's
feeling good.
asking for medication again, and you saw earlier that we are carrying the Impium Cilastatin. So I'm going to scan this, and I'm just going to ask, you know, since I have a student nurse here, what's your name and age again?
Expiration date.
Shanae O'Connor, 34.
Okay. You know, the scanners are sometimes hard to work, and we always want to make sure we have the right patient. We want to pass along good traits, not bad ones.
On here.
Good teaching.
So I pretty much checked everything at least 3 times throughout the entire process, through setting it up and scanning and double checking and expiration dates and everything. So we know
Can you
it's the
tell
right
me your
medication,
name
it's the
and
right
your
time, the right
age,
patient.
please?
I've asked that several times.
Yes, I have to say yes.
Sorry?
Name and age, please.
So
Oh, I am Glenn Light, and I'm 67 years old.
Okay, I'm gonna scan your armband.
we will document.
White, 67, no allergies, medication.
I have
And
remember
I'm
I
just
wrote
rechecking the
time
medication,
we changed,
Westboro.
Okay.
flushed or
expiration
primed
date.
everything. We are ready.
My alcohol swab and scan at the top here.
So we'll watch 5 drops.
Okay.
Insulin syringe.
Okay.
First thing I'm going to do is pull back 6 units.
4 and 5. Great.
Okay, great.
So everything's running smoothly now.
6 units.
We will clean up. We don't want
6
to
units of air. And it's going to pull
make sure we have everything. You, how is everything feeling? Still good with the IV?
Yeah, still okay.
Wonderful.
and with one hand cat method.
So next, I have almost everything
Syringe.
completed. What I'm
I'll
going
just
to
make
do
sure there's no
is
air bubbles.
everything is documented.
So I saw the last time they did you right over here, so I'm going to go on this side, okay?
Okay.
Clean the skin real good.
Set up everything,
Just
just
skin.
double checking
1,
that the
2,
antibiotic is
3.
put in correctly, because we want to make sure we have the Impium.
Needle.
So it's all programmed correctly.
Check my time here.
It's 500 milligrams and 100 milliliters. We're double checking. Yes.
Wash my hands.
So I saw in my instructions that it actually said over 1 hour. So we're going to do it over 1 hour. So it is duration.
So I'm going to leave you to eat your dinner, and I'm going to make sure that I have some education for you, and it's going to go in your little education packet for you to go home with, and it's just about the medication that we gave and a little bit about how to control your diet at home. So we're going to make sure that we put that in your packet on our way out, okay?
Okay.
Is there anything else I can do for you right now?
Nope, I'm good. Thank you.
Okay, perfect.
Okay.
Thank you, sir, for letting me follow her.